Good morning, ladies and gentlemen. Um, my name is David Ojo. I am an architect and an assistant lecturer at the Faculty of Engineering and Information Technology here in Pécs. And with Dr. János Gyergyák, we have prepared this presentation titled Buildings, Health and Climate Change for you today. And so I will just go right in. So the first topic that we are going to address is health issues in urban areas due to climate change. This is probably the best way for us to approach this topic from a kind of general macro approach. The first thing is rapid urbanization. This is a concept that is currently very popular and is happening right now when we talk about how our cities are developing. This stat says that the number of city dwellers is expected to rise to nearly 7 billion by the year 2050, which means that basically in about 25 years, almost the entire population of the world will only be living in cities, and then you can imagine how much rural residents we have right now. So people that are living in cities are already experiencing and will be increasingly exposed to the negative effects of urbanization and the health impacts of climate change. And some of them I will just go through so that we can actually look at what these effects are of rapid urbanization. So the first one is extreme heat. There's also air pollution, coastal floods, changing patterns of infectious diseases, and food insecurity. So the first is extreme heat, the urban heat island effect. This is the difference in temperature between the built environment and the natural surrounding environment. Various urban structures and processes play a role in the urban heat island effect. So buildings and pavements absorb, store, and ultimately release the heat back into the environment. So this is a big issue that we have in our urban cities and urban environments. There are also processes such as electricity generation and also waste heat that's generated from building operation and use that only adds heat to the environment. So this is basically, from this diagram, we can kind of get the general idea of what we mean when we're talking about the urban heat island. So one of the big issues that we have when we are talking about urbanization and developing our urban areas, the strategy for many years has been to build, and build more, build higher, build bigger, but unfortunately, these have a massive negative effect. So you can just see the diagram there for our urban situation, where it's a lot of buildings, it's a lot of paved areas, and this just means that all the heat is getting absorbed, and so it ultimately is also released back, and during the day that can be 5 to 7 degrees, but it's also documented that it can be up to 22 degrees Celsius at night, which means that the effect is quite high of what these surfaces absorb. So it's important for us to take note of this and see how to combat it. So the higher temperatures caused by the urban heat island effect can increase the risk of heat-related illnesses such as or heat stroke, or heat stress, and even death. So there are also death-related or death as a result of these heat-related illnesses. And then climate change is leading to higher temperatures and longer, more intense and more frequent heat waves, which means that the urban heat island effect also intensifies, because the longer the sun is out, the more heat that is generated, and the more heat these buildings can absorb. And so this already shows that study shows that global warming is responsible for over a third of all heat-related deaths. The next is air pollution. The WHO estimates that almost the entire world's population is breathing some kind of percentage of polluted air. And air pollution data from urban areas indicates that almost all city residents face an increased risk of heart disease, stroke, lung disease, cancer, and pneumonia. So all of these as a result of kind of the air pollution that comes especially from the burning of fossil fuels. So that's a big deal as well in our urban areas. There's also coastal flooding. In the future, climate change is expected to worsen the coastal flood hazards through sea level rise and an anticipated increase in the intensity of cyclone events, as well as mortality. Flood events are known to cause injuries, infection, and mental health problems, sometimes indirectly. So, pardon the slide here, but yeah, so these issues, they can, of course, like cause death immediately, but then also indirectly, there are, later effects of the coastal flooding, so injuries, infections, and mental health problems. And we also see that the rising temperatures are expected to bring sea level rise, and this is particularly an issue when we talk about coastal cities and coastal urban areas. So what we see in these mega cities and other population centers that are growing rapidly, again, what I presented at the first slide talking about the rapid urbanization. And so many of these are low-income countries where the vulnerabilities to disasters is high because they do not have the strategies to combat these floodings. Yeah, so the next is changing patterns of infectious diseases. Longer warm weather seasons and changing rainfall patterns are allowing insects that can transmit vector-borne disease to humans to thrive for longer periods each year. So these are diseases like malaria, dengue, and also the West Nile virus. And so because of the longer warm weather seasons, basically the insects can reproduce and are more comfortable, and then they can transmit diseases more easily and also simultaneously move into broader areas. And the rapid urbanization means that there's a larger population that these diseases can affect. So that's one of the other impacts. And then the fifth one that I wanted to present is food insecurity. So warming is projected to reduce global crop production by over 10% by 2050, resulting in increased malnutrition. And this presents dire challenges to food security in urban areas, especially in developing countries, contributing to an increased mortality rate due to climate change. So all these things, when we look at them from a concept from the first thing in rapid urbanization, and we consider how all these things will affect cities that have more people in them, then they are all dangers. So the question then is, how do we design our urban areas and to combat these climate change health issues that we have kind of seen? So the first thing is to present what urban planning is. Urban planning is a technical and political process that is focused on the development and regulation of land use, protection and use of the environment, public welfare, plan of the environment, including air, water, and infrastructure passing in and out of urban areas, such as transportation, communications, and distribution networks. So this kind of takes a top-down approach, so it works through the technical and political processes, entirely planning the whole city. And this is important because strategic urban planning will be key to creating supportive and enabling environments for health, making sure that health and equity considerations are integrated throughout the planning process. Investments and policy decisions are at the local level. So it will be important that there is some strategic urban planning to kind of figure out how to make sure that health and equity are some of the most important things that are talked about when we are having these conversations about urban planning, that they come to the forefront, as well as, of course, cost and other things. So it would be important that these are, that health and equity are at the top of the list as well. Then there's also urban design. Urban design is a bridge between architecture and urban planning. It's multidisciplinary. It's a multidisciplinary complex process, and it's the relationship between the built and the unbuilt space. And it concerns the art of making better places for people and public life. And maybe this is where we need a combination of both, and why urban design is important, because this is where we now, of course, need to take into account like the people who are actually living in the cities. As I mentioned when we looked at what the urban heat island effect is, so it is important to have the balance between the built and the unbuilt areas, because this is what actually makes sure that, for example, just in that one case, we can combat this urban heat island effect, or reduce its negative connotations on the city, because when there is that consideration of how the built environment should be and how the unbuilt environment should balance it, then there is better chance that we can actually make these better places for people in public life. So cities can and should promote health through the reduction of air pollution, noise, and urban heat islands, the promotion of active and healthy lifestyles, the provision of available and affordable healthy food, climate action and proper housing conditions, waste management and sanitation, among others. So just some strategies that would be important when we are thinking about urban design and how to design our cities. These are things that we must look at. These are things that we must take into consideration. And our cities will be used in the way that we design them. So it is important that we take these things into consideration. One of the solutions, basically, when we consider urban planning, urban design, how can we actually design our cities, is what a concept that we call the sustainable city, and something that is very important in all architectural discussions on the urban scale right now. So the sustainable city is basically urban sustainability. So this is a city designed with consideration for social, economic, and environmental impact, of course, the three pillars of sustainability. The sustainable city should meet the needs of the present without sacrificing the ability of future generations to meet their own needs. So this is, of course, a definition I'm sure we're all familiar with from the Brundtland report, and it has to be a holistic and integrated approach. So some sub-concepts of urban sustainability. We have the compact city, we have the resilient city, and the smart city. So the compact city, you can see a diagram just at the top right there, where that is focusing on making sure that the most practical needs of residents are kind of within reach. So diversifying, bringing in parks, mixed working areas, some higher density housing, and then there are also residential areas, there are also public areas, so kind of making sure that there are different strategies that are implemented. Then the resilient city, of course, is also about making sure that we have cities that can respond to whatever changes that are happening. For example, designing cities that could respond to a global pandemic, and things like that. So there are different ways to measure the city resilience. So we can see in the environment, the population density is important, which again relates to this rapid urbanization that's taking place. And there are the accessible green areas, so the built-up areas. And then there's governance, the economy, and society as well. And then we also have the smart city that basically introduces the Internet of Things and figures out solutions on how we can have basically better cities, and it implements various concepts, so intelligent shopping, smart waste management, things like this. So all of these contribute to making sustainable cities, which ultimately contributes to combating climate change and leading to better health for residents. And finally, I would also like to present some strategies, some sustainable city strategies that are important, that we can take note of and account of when we are designing our cities still. First is reclaiming public spaces for people, which is important because maybe connected to the third one, promoting sustainable mobility and active lifestyles. When the public spaces are reclaimed and they are designed specifically for people, that means that they need to go out and live healthier lives. At least this is how we kind of understand it and see it. And it is important then because there's interaction with nature and the environment. Reducing motorized transport, of course, reducing, this directly relates to reducing emissions and leading to more sustainable methods of transportation. Providing urban greening, so from the rapid urbanization slide, we could see that there are so trees immediately in the urban environment help to cool down and reduce the urban heat island effect. And so that would be important to provide this urban greening, which is essentially planting more trees and increasing the amount of greenery that we have in our cities. Then we also have mitigating effects of climate change through heat reduction methods like cool or green roofs. This is also related to the urban heat island effect directly, where because of course we do need buildings. This is where everything really takes place, and so there are strategies that reduce the amount of these surfaces that present issues that increase the urban heat island effect. So when there are green roofs or what we call cool roofs, then that already presents an important solution. Then there's also implementing nature-based solutions to improve thermal comfort, reduce pollution, and reducing the climate risks such as floods, as was mentioned earlier, and then also utilizing early warning systems to become aware when there are issues in the environment. So when the air quality is low, when there are things that require immediate intervention or action because of these early warning systems, and it becomes easier to address this. So climate adaptation will ultimately result in numerous health co-benefits, as was mentioned in some of the earlier presentations, and it needs to be encouraged at a global urban scale. And so these are kind of the concepts that we need to think about if we want to actually address and encourage climate change adaptation in our urban situations. Thank you very much.